Welcome DEKWP, Xiaogong Abor. Your learning journey starts now. Right, let's jump straight into the deep end. We're looking at a fascinating movement in China called active medicine. Forget just waiting for the doctor when you're sick. This is about taking charge, preventing illness before it even starts, and using cutting edge tech to keep us all healthier. It's a big shift, and it's being driven by some seriously smart people. So, who's thinking about this stuff? First up, the theoretical constructors. These are the folks laying the groundwork, the philosophers and scientists defining what active medicine actually means. Think of them as the architects of this new health paradigm. Take Yukong Duan from Hainan University. He didn't just coin the term active medicine, he also came up with the DIKWP model. Now, you might know DIKW: data, information, knowledge, wisdom. But Duan added purpose P to make it DIKWP. Why? Because he believes that true intelligence, even artificial consciousness, needs to understand purpose. It's like saying knowing how to drive isn't enough, you need to know why you're driving somewhere. Then there's Lang Zhuangli, another academician, who's a real hero in the pandemic response. She didn't just react, she developed systems for active monitoring and AI powered early warning for infectious diseases. Her digital epidemic prevention was crucial. Imagine having an AI system constantly scanning for potential outbreaks. That's proactive. And Daming Fan, founder of Holistic Integrative Medicine, echoes ancient wisdom with a modern twist, treating disease before it arises. This isn't just about herbs, it's about a whole body approach, integrating different methods to stop problems before they start. It's like fixing your car's oil leak before it breaks down on the highway. These thinkers are pushing boundaries, blending ancient ideas with futuristic concepts like digital twins and AI ethics, all aimed at making healthcare more proactive and purposeful. Okay, so the thinkers have the blueprint. Now, who's actually building the tools? That's the job of the technology developers. These are the innovators crafting the hardware and software that make active medicine possible. Think about Xue Jizhang from Shenzhen University. He's working on wearable nanosensors. Imagine tiny super-sensitive patches you could stick on your skin that constantly monitor your vital signs, blood pressure, glucose levels, maybe even stress hormones, all in real time. That's intelligent biosensing in action. Or Wang Huang, the brains behind the wildly popular Xiaomi band. His company, Huami Tech, is a global leader in wearable devices. They're not just tracking steps, they're collaborating with giants like Zhongnanshan on post-discharge care for COVID patients. It's about using tech to manage health continuously, not just during a hospital visit. Then you have the AI wizards. Quen Chen from Infravision made AI so good at reading X-rays and CT scans for things like lung nodules or stroke signs that it's helping doctors in smaller hospitals access expertise they previously couldn't afford. Long Zhu from Yitutech did similar work, especially during COVID, creating tools that could analyze CT scans incredibly fast, helping triage patients. Qingfeng Liu from iFlyTech built the medical brain system. This isn't just a chatbot. It uses voice recognition to help doctors document patient records and even assists with diagnosis. It's estimated to have helped over 56,000 doctors make nearly 500 million diagnoses. That's massive scale. And don't forget the platform builders like Hao Zhang from Ping An, creating citywide health management systems, or Hao Tin Cheng from Alibaba Cloud, who built the very health code apps used during the pandemic. These aren't just apps, they're complex digital twins of health systems, tracking populations, and enabling rapid response. These tech pioneers are turning the theories into tangible, powerful tools that can reach millions. Now, having the best theories and coolest tech is great, but how do you actually use it to help people? That's where the clinical translators come in. These are the doctors and clinicians who take these ideas and technologies and apply them directly in hospitals and communities. Let's start with Nanshan Zhong, the respiratory disease expert and academician. He's famous for his mantra, early detection, early isolation, which was critical during the COVID-19 pandemic. But he's also a big advocate for public health, promoting exercise and healthy lifestyles as fundamental prevention strategies. It's about empowering individuals. Remember Lan Juanli from The Theorists? She's also a powerhouse clinician. During the pandemic, she didn't just talk about AI, she implemented it, using AI to help triage fever clinic patients and even repurpose existing drugs to fight the virus. She also pushed for hospitals to be ready for both peacetime and wartime scenarios. Chen Wang, another academician, focused on integrating public health principles into large teaching hospitals and bringing specialized care like COPD management out into the community. It's about making healthcare accessible and preventative, not just reactive. And look at Ningli Wang, leading the national effort to control myopia in children. She embedded vision screening into routine school health checks. That's translating a public health goal into a practical, widespread action. These clinicians are the bridge. They take the fancy AI algorithms, the wearable sensors, the new screening protocols, and make them work for real patients, whether it's detecting cancer early, managing chronic conditions, or promoting healthy habits in schools. They're the ones making active medicine a reality on the ground. So, we've got brilliant thinkers, amazing tech, and skilled clinicians. But none of this happens without the right environment. That's where the policy promoters step in. These are the policymakers, government officials, and strategists who shape the rules and funding that allow this entire ecosystem to flourish. Xiaowei Ma, the director of the National Health Commission, NHC, spearheaded the ambitious Healthy China 2030 plan. This isn't just about hospitals, it's a national strategy emphasizing prevention and encouraging individuals to take responsibility for their own health. Think of it as setting the national health mission. Xue Junyu, also from the NHC, was instrumental in drafting the action plan for this initiative. Crucially, he linked hospital evaluations to how well they integrate medical treatment with prevention. So, hospitals aren't just judged on how many surgeries they perform, but also on how effectively they prevent illness. Long De Wang, another academician, was a key architect of the National Disease Reporting System and launched the Three Reductions, Three Healths campaign. This aimed to reduce smoking, alcohol consumption, and salt intake, while improving health literacy, physical activity, and mental well-being. It's a classic public health strategy, but scaled nationally. Zhu Qian, a former health minister, championed the basic healthcare law and pushed hard for reforms focused on grassroots healthcare and prevention first. Chunlan's son, a former vice premier, oversaw the launch of Healthy China 2030 and famously enforced the dynamic zero COVID policy, which, despite its challenges, demonstrated a highly proactive approach to containment. These policymakers are setting the stage. They provide the funding, the regulations, and the strategic direction that enable researchers to innovate, tech companies to build, and clinicians to implement. Without supportive policies, even the best ideas struggle to take root. Finally, let's talk about the industry representatives. These are the entrepreneurs and business leaders who are taking all these innovations and scaling them up, bringing them to the market, and making them accessible to the public. They're the engine of commercialization. Zhe Yuanliao founded WeDoctor, which created one of the first major online appointment systems and internet hospital platforms in China. This allows patients to consult doctors remotely, access test results online, and manage appointments digitally. It's a game changer for convenience. Tao Wen from Ping and Good Doctor launched a service offering 24/7 access to AI-powered health advice combined with human doctor consultation. With over 300 million users, it's a massive platform demonstrating the demand for accessible digital health services. Tian Li built DXY, China's largest online medical community. It's not just a forum, it's a platform for doctors, patients, and pharma companies, and Li has used it powerfully to expose health fraud through public science communication. Talk about using tech for good. Robin Li from Baidu invested heavily in AI for healthcare, including the Medical Brain Project and Biomap, which uses AI to accelerate drug discovery. Jian Wang from BGI scaled up genetic testing, making it feasible for widespread screening of birth defects, hereditary diseases, and even early cancer markers. Others like Rong Yu and Li Gangzhang are running massive health checkup chains, integrating AI and connecting with national chronic disease programs. Duangxian Gao at Alibaba Health unified online pharmacies, telemedicine, and vaccine booking under the Alipay and Tmall ecosystems. These industry leaders are taking the promising technologies and research findings and turning them into viable businesses and services. They're the ones ensuring that innovations like AI diagnostics, wearable monitors, and genetic screening move beyond the lab and into the hands of millions of people, making active medicine a tangible part of everyday life. So, wrapping it all up, this list paints a picture of a truly collaborative effort. You've got the deep thinkers defining the philosophy, the tech wizards building the tools, the clinicians putting them to work, the policymakers setting the stage, and the entrepreneurs scaling it all up. It's a powerful convergence driving a real paradigm shift in China's approach to health, moving decisively towards being more proactive, preventive, and empowered by digital technology.